So, Dr. Naderi-Azad completed her medical training at the University of Toronto and family medicine residency at St. Paul's Hospital. She's obtained her HealthCert postgraduate diploma of general dermatology, which included training in dermoscopy and its utility in the diagnosis and management of skin cancers. She has 17 publications in top dermatology journals on primary care skin conditions, including eczema, psoriasis, vitiligo, and melanoma, and completed numerous dermatology electives in Vancouver and Toronto. So thank you so much, Dr. Naderi-Azad, for joining us this evening.
Hi, everybody. I'm Sheida Naderi. I am a GP dermatologist, so a family physician with additional training and interest in dermatology in Vancouver, British Columbia. Um, just a list of some of the services that I have been able to provide. If you are from Vancouver, BC, you probably have been familiar with the kind of the dermatology service here and how there is, similar to many other provinces, a little bit of a backlog in terms of the wait times and things. And so there have been some dermatologists in the province who have retired or gone out of province. And so it seems like a right fit for me to be able to just kind of help with some of the filling of the gaps in the area. So the talk does include a little bit about three, most major skin cancer types, including basal cell, squamous cell, and malignant melanoma. With regards to the skin cancer types, the areas can appear on any site on the skin, including the palms of the hands, soles of the feet, and even on the scalp. There are two main types of skin cancer. So there's the non-melanoma skin cancer types formed primarily by keratinocyte cells, and these include the BCC and SCC. And then there's also malignant melanoma created largely by melanocyte cells. So a little bit about the statistics of skin cancer. So skin cancer can occur in one in every three types of cancer worldwide. And there's 80 to 90% a number of skin cancers that are caused by UV radiation. Over 80,000 cases of skin cancer are diagnosed in Canada each year. The early diagnosis is very beneficial, as you can see that the 5-year survival rate for melanoma is 99%. And Canadians born in the 1990s have 2 to 3 times higher risk of developing skin cancer in their lifetimes than those born in the 1960s. So starting with basal cell cancer, BCC is by far the most common form of skin cancer. It accounts for 90% of all skin cancer types, starts in the basal cell layer at the bottom of the epidermis, which is the outer layer of the skin. Some of the clinical features can include persistent non-healing sores, a reddish patch or irritated area, a pink growth or scar-like area. These types of skin cancer are usually quite localized and can be treated by fully removing them, but they can also become a bit more advanced and spread to other surrounding areas. Next is a squamous cell cancer. So SCC is the second most common type of skin cancer. It starts in the epidermis and can eventually penetrate the underlying tissue. Some of the clinical features can include creation of a wart-like growth, crust formation, occasional bleeding, persistent red patch with irregular borders. The prognosis, similar to basal cell, a lot of times the squamous cell cancers can be localized and treated with the full excision and ensuring that all of the cancer cells have been fully removed, but advanced SCC can also spread to the nearby areas. Next, we have actinic keratosis. So this is one of the precancerous cells, the skin condition caused by exposure to ultraviolet radiation. It is the earliest form of SCC, and because of its precancerous nature, it is recommended that we treat the actinic keratosis until it is fully treated and resolved. The sites can appear anywhere on the body, but in particular on the sun-exposed areas, including the face, neck, shoulders, and the back. And it can show as rough, dry, scaly patches that can develop over time. And then we have malignant melanoma. So the most serious type of skin cancer, the most common sites differ based on whether or not they are found on men or women, on men on the back and the women on the legs. Some unusual sites that also we should take caution towards include the mouth or oral mucosa, eyes, and nails. So it's not just restricted to this the kind of openly areas on the skin. The prognosis it can be variable. It is one of the leading causes of the mortality. And when it comes to malignant melanoma, there is the ABCDE criteria that you probably have heard about. So these are the factors that I would recommend you try to watch out for and keep in mind in terms of factors that should bring you into the doctor's office sooner if needed. So if you notice a mole on your skin, I would watch out to see if there's any asymmetry. Any borderline irregularity, so just kind of jagged border lines, kind of like the country outlines on the map. See if there's any color heterogeneity, so multiple colors on one spot. As you can see, there's some darker brown, lighter brown spots, and there can also be additional colors like blue, black, red spots in one area. D diameter, if it's greater than 6 millimeters or if it grows really quickly, and E evolution, so if it changes in size, shape, or color. So these are generally good factors to keep in mind for a sooner prompt to the doctor's office. There's also the 7 points checklist that may be considered as another criteria. So scores 3 or more points may warrant a referral to a specialist for further examination and or biopsy for diagnostic confirmation. So various factors are involved, similar to the ABCDE criteria. Some of the additional factors that can be involved include itchiness, tenderness, oozing, crusting, or inflammation. There are various risk factors when it comes to skin cancer development. Complexion, so fair-skinned individuals, those with blue eyes, red hair, individuals with 50 or greater moles on their body, those who have had prior tanning bed use, as well as those with past history or family history of skin cancer, history of sunburns, in particular blistering sunburns in childhood, as well as those with history of immunosuppression or prior organ transplant patients. Most of the skin cancer cases are preventable. I generally recommend wearing sunscreen in all weather conditions every 2 hours. Generally, even in the Vancouver winter, which I say is usually cloudy because the UV rays can penetrate through the clouds, even behind the windows. If you have a lot of sun exposure, I would recommend wearing lots of sunscreen. Just some of the sunscreens that I would recommend that I have tried personally and I've had good experience with. In general, any sunscreen with SPF 30 or above is a good idea to use in terms of protection. And as you can tell, early detection improves morbidity and mortality. So some other things that can be done in terms of detection, skin self-examination, as well as clinical examination by a dermatologist or general practitioner. In those with additional risk factors that I had described, it would be a good idea generally to have an annual skin examinations, and in some cases, every 6-month skin examinations, just to make sure that there are no concerning cancerous lesions that may be missed. Other skin cancer detection strategies can include mole mapping as well as dermoscopic examination of lesions of concern. So just a little bit about dermoscopy. So it magnifies skin lesions by 10 to 20 times.
The life hack that you randomly saw one day that is now an unconscious standard practice in your life. I'll go first.
So as you can see, this video is just a very short video, but describing some of the various features in dermoscopy that can be seen that cannot usually be visualized with the naked eye. So it's a really good toolkit to have in the physician's office. So some of the dermoscopic findings, so squamous cell cancer in this case, as you can see, there are certain features that can be seen, including the kind of in the induration and hyperkeratosis, which is the thickening of the skin that you can see through Dermoscopy, another one. If there are moles found on the nails or on the skin, it can be used to further visualize to see if there are any atypical dots and lines and things that can help us differentiate between moles or a hemorrhage, which is kind of bleeding areas, or more concerning lesions. So similar to the slide about the risk factors, I would recommend annual skin examinations for those with additional risk factors. Some of the factors that I have not discussed in the past include things like phototherapy that patients might receive for eczema or psoriasis, as well as some of the previously described features. In general, some of the criteria that we discussed do include kind of red bleeding spots for basal cell cancer, more of a wart-like feature for squamous cell, and the ABCDE criteria for malignant melanoma. But of course, there are numerous nuances, and it's not a one-size-fits-all description. So self-examination pointers, in general, I would recommend starting with the head and ending with the feet, including, your scalp, your face, neck, beneath the facial areas, and the trunk. And as you can tell, some of these areas, including the scalp and the trunk, can be difficult. Some would say impossible for you to examine by yourself. So sometimes it can be helpful to have a family member or a partner also help to take a look, including areas such as the armpits, hands, finger webs, and nail beds can also be particularly helpful. Mirrors can also be used for visual aids, and I would also include toe webs and toenail beds and the bottoms of the feet as well. So when should I see the doctor? So anything that you find that might be concerning you is a good idea to have that checked. And also I would generally recommend, some family physicians are quite experienced in doing the skin cancer testing. Some are not. So it depends a little bit on the comfort level of your physician, whether or not they would like to have a referral. And then if there's a lesion that's concerning, there are various ways through which it can be biopsied, which is just taking a sample of the lesion of concern and sending it off for pathology. They look at it under the microscope and look for abnormal cells. So just one example of a biopsy procedure that I had done recently. So as you can see from the video, the biopsy procedures are quick procedures that can be done in clinic, don't require visits to the hospital generally, and it only takes a few weeks for the results to come back for pathology confirmation. Sometimes it can be hard finding a physician in Vancouver or, elsewhere in Canada as well. And so if you are struggling for family physician finding, there are a few strategies that I have been recommending. Receiving a referral from your family physician or walk-in clinic for annual skin examinations can be helpful in getting you in the system. The referral system has changed here as of June 2023, where you can now see the specialist for the same reason of referral on an ongoing basis every 6 to 12 months. So as long as you have a one-time referral for an annual check, you are able to see your dermatologist or GP dermatologist for routine screening. And then there are certain GP dermatologists that I would recommend you try to look into, finding if you have a long wait list or dermatologists who are not accepting patients for annual skin exams. And so some of the information that I have been sharing with patients or family members of those with melanoma or other types of skin cancer, if you are looking for a skin check examination in Vancouver. And some references and just some additional resources if you would like to stay up to date with some skin cancer screening strategies. Thank you so much.
Thank you so much, Dr. Naderi-Azad, for joining us and for that very detailed presentation.